Management and treatment. Following steps can help in PMS. Step 1. Lifestyle modifications. Dietary changes. Reduce caffeine and sugar intake. Reduce alcohol intake. Increase complex carbohydrates and fiber. Limit salt to reduce bloating. Exercise. Regular physical activity to reduce symptoms and improve overall health. Stress management. Techniques such as yoga, meditation, or counseling. Step 2. Medications. Over-the-counter pain relievers. NSAIDs like ibuprofen or aspirin, to alleviate pain and discomfort. Hormonal treatments. Oral contraceptives to stabilize hormonal fluctuations. Gonadotropin-releasing hormone agonists in severe cases. Antidepressants. SSRI or SNRI for mood-related symptoms. Step 3. Alternative therapies. Use of supplements. Calcium and magnesium. Vitamin B6. Evening primrose oil. Herbal remedies. Chasteberry, ginkgo biloba, and St. John's wort. Acupuncture and acupressure, for pain relief and stress reduction.